a WikiVidi Documentaries production. Don't forget to like and subscribe. Enjoy. Extracorporeal membrane oxygenation. Extracorporeal membrane oxygenation, also known as extracorporeal life support, is an extracorporeal technique of providing prolonged cardiac and respiratory support to persons whose heart and lungs are unable to provide an adequate amount of gas exchange or perfusion to sustain life. The technology for ECMO is largely derived from cardiopulmonary bypass, which provides shorter-term support. This intervention has mostly been used on children, but it is seeing more use in adults with cardiac and respiratory failure. ECMO works by removing blood from the person's body and artificially removing the carbon dioxide and oxygenating red blood cells. Generally, it is used either post-cardiopulmonary bypass or in late-stage treatment of a person with profound heart and/or lung failure, although it is now seeing use as a treatment for cardiac arrest in certain centers, allowing for treatment of the underlying cause of arrest while circulation and oxygenation are supported. Medical uses. Guidelines that describe the indications and practice of ECMO are published by the Extracorporeal Life Support Organization. Criteria for the initiation of ECMO vary by institution, but generally include acute severe cardiac or pulmonary failure that is potentially reversible and unresponsive to conventional management. Examples of clinical situations that may prompt the initiation of ECMO include the following. Blood. Heparin-induced thrombocytopenia is increasingly common among people receiving ECMO. When HIT is suspected, the heparin infusion is usually replaced by a non-heparin anticoagulant. There is retrograde blood flow in the descending aorta whenever the femoral artery and vein are used for VA ECMO. Stasis of the blood can occur if left ventricular output is not maintained, which may result in thrombosis. Mechanical ventilation. The CESAR study has shown an improvement in 6-month survival without severe disability in patients getting ECMO versus conventional ventilation in ARDS. Bridge to assist device. In VA ECMO, those whose cardiac function does not recover sufficiently to be weaned from ECMO may be bridged to a ventricular assist device or transplant. A variety of complications can occur during cannulation, including vessel perforation with bleeding, arterial dissection, distal ischemia, and incorrect location, but these events occur highly infrequently. Research. A 2014 study showed that a factors IE inhibitory antibody provides thromboprotection in extracorporeal circulation without increasing bleeding risk. Experiments on neonatal animals showed that ECMO treatment can lead to apoptosis of enterocytes, damage of the intestinal mucosal barrier, and bacterial translocation. This might explain greater severity of systemic inflammatory response syndrome in neonates. ECMO has also seen its use on cadavers as being able to increase the viability rate of transplanted organs. Brought to you by WikiVidi Documentaries. Would you like to know more?